If your client has edema that is more subacute or chronic, and therefore more viscous because it's gathered more protein, a chip bag or a chip pad that contains various densities of foam chips can be used under your compressive glove or under the compressive sleeve to help soften up the edema that's become really thickened. So I'm just have some kinesio tape here that I've laid out, and I'm putting some chips on. You could use some stockinette as well and then put them in there. I think the kinesio tape works a little better. You could also use Leukotape or some other thin tape. And I think it works better just to hold the chips in place. So I'm going to just put a couple more chips on the tape here. You just put them on in more or less a random fashion. You don't want to have all high density kind of in a row or anything like that. You want them to be on there in a fairly random fashion. And once you have a good amount of chips on your tape, you'll just take this and you'll just fold it over on itself, more or less like that, and smoosh it all down so that now you can see we have these various densities of foam all contained in this little chip pad. I'm just going to trim off the end here. Then once you have your chip pad or chip bag with the different densities of foam, let's just say that our client maybe had some really brawny thickened edema on the back of the wrist. What you could do then is just take this and apply that to that edematous area where that edema has become really thickened, and then put the compressive sleeve over top of that. And then those different densities of foam in the chip pad under the sleeve will help to soften up that thick brawny edema, making it easier for the lymphatic system to pull that out of the extremity.